Whatever the substance, whether it be alcohol, heroin, opioids, methamphetamine, addiction to these substances is a huge crisis in our country. People are dying of overdoses every single day, and it's getting worse.
This is something that doesn't care what your zip code is, doesn't care what your background is. The disease of addiction doesn't discriminate. And it is a deadly disease. It is a chronic fight. It's something that you have to battle every day.
I grew up where both parents were drug users. I was introduced to cocaine at the age of 13. At the age of 16, I tried heroin, and that was the beginning of it.
My drug use got so bad, I ended up losing my job. I lost everything. I started picking up charges, cases, getting in trouble.
I did 5 years in prison. When I went in for the first time, it was a whole new world for me. I met Marita.
I was in and out all the time, and this time around, 2016, I had lost my child.
We used to talk about future, what are we gonna do when we come out, how we can help other people.
And I decided that when I come out, that I was gonna do the right thing. You know, I had some time to sit down with myself and think about what I wanna do with my life and for my child.
And that's where ATR came in.
Massachusetts Access to Recovery, ATR, is a 6-month program designed for individuals with substance use disorder and who are seeking support with their recovery.
The goal of ATR is really to provide services to clients who have substance use disorders through a variety of non-traditional recovery support services.
When you've been gone a long time and it is so overwhelming, that upcoming release, that ambiguity of not knowing what you're going to do can become the straw that breaks the camel's back.
I didn't have no support. I had no one. I came out of prison after 5 years. Everything was brand new to me and I needed help.
ATR was based on the premise that there are multiple pathways to someone's recovery. Some people do very well with only clinical, traditional treatment for their substance use disorder, but others either don't want to go into treatment or don't do as well there. In addition, even after you leave treatment, you still need to address the social determinants of health so that when the person re-enters the community, they have a way to face the obstacles that they faced before they ever went into the treatment. A person is referred to ATR and immediately is assigned to one of our ATR coordinators who meets with them in an intake interview and begins an engagement with them for the 6 months they're going to be in our program. They help them to identify recovery goals, and the ATR coordinators work with the participants to choose the services that will benefit them the most during the time that they're in the ATR program.
I took advantage of everything they had to offer. They gave me guidance, bus passes, they gave me clothes.
That simple bus pass took me everywhere.
ATR allowed me to pick out and purchase my own clothing that I wore to job interviews that made me feel like I was okay. That was a hand up, not just a hand out.
We believe strongly that it's a participant-driven program. They are really encouraged to think on their own and to be in charge of their own lives.
Before, I didn't have that support from anyone, and I found support in ATR.
So ATR chose employment as the laser focus of our program because we know that it is only through getting a job that you can have financial stability. ATR's employment program is divided into 2 different components. The first is a 3-week job readiness training program that we co-developed with the Massachusetts workforce system called MA-ATR. It's a standardized curriculum that includes items and topics such as confidence building, career exploration, and specific job search skills such as resume creation and interviewing skills. The second component of our employment program is an occupation-specific job training program in occupations that we know are receptive to hiring our participants, many of whom have criminal backgrounds and very long gaps in their work history. Our employment program is based on the premise that people have to be able to compete in the current labor force. So it is critical to upskill them so that when they're finished ATR, they will be able to be qualified for a good quality job in the marketplace.
I had no skills for work. I went to ATR. So you take these classes and they teach you about the trades, and then you get to choose which trade you want to get into. And ATR helped me get my license, and I got in the union.
We pay for people to go through all these job training programs. We also give the participants a work-study benefit of $10 an hour for every hour they attend those CBI, Career Building Initiative programs.
I went from being homeless to a full-time job. They saved my life. I mean, and I'll say it all the time, and I speak from my heart.
I'm here today because of that.
Recently, we added another service line to the ATR menu of services. ATR now pays for rental assistance in these sober homes, which are certified by the Commonwealth of Massachusetts. Sober homes are private group living homes that are drug-free. They're intended to provide safe homes and supportive, structured living for people who are struggling with drug addiction.
By removing that stress level and that source of anxiety, it really allows the ATR participants to focus on their recovery, to really get into goal setting and what steps do I need to take to achieve the next level.
We have found that by providing rental assistance for their sober home stay, it takes away a lot of the pressure and the anxiety about how are they going to pay their rent. And it allows them to focus on what's important in the moment, their recovery and their ability to become self-sufficient by going through one of our job training programs.
The continuum of care and the care triangle that's created by the ATR program with all the support from the intake personnel, the housing coordination staff, and then the boots on the ground, the recovery coaches. It really does, it forms a team. It lets the participants know that they have people in their corner.
In the sober home, we want to provide lots of supportive services to them. So the recovery coaches are there to really help that transition and get them ready to be independent in the community.
So as a person in long-term recovery, I can relate a lot with my participants with life experience, know what they're going through, and helping them navigate through their sobriety while they're in the Sober House program.
Now I work as a recovery coach in the community. All these people that I work with, they know me from back then when I was in the same spot they were, and now they see me. So it's like an inspiration to them that recovery is possible and that there is help out there, and especially with ATR, to remove them barriers.
If it wasn't for these resources in the community that we have, a lot of people would not make it.
The outcomes of the Access to Recovery program are really phenomenal. Decreased rates of criminal justice involvement, decreased rates of drug use, increases in employment, increases in housing, and improvement in quality of life.
I've been out of jail over 6 years, going on 7 years. I've been away from drug use for that time. I do it, just by doing the little things, working, family, being around the right people. Normal stuff, but it's awesome.
I was released from prison June 21st of 2017. June of 2019, my girlfriend and I closed on a house in Pawtucket, Rhode Island.
My son was just about to be adopted, and I had turned my life around. And here I am, I regained his custody, and I'm doing great.
In the same spot that I used to sell drugs and I was selling death, I'm bringing recovery. The same people that I sold drugs to, I'm giving them life now.
And it's all because of ATR.